He's over here. All right, everybody. This is Brittany at Big Cat Rescue here in Tampa, Florida. I am in the Windsong Memorial Hospital. And you can barely see him on the table because he's white and that light is very bright. But Dr. Justin is here to examine Pharaoh. Oh boy. So Pharaoh was sedated today because he's been on the chart for not pooping, and now he has stopped wanting to eat. So he's in today for blood work, which we've already drawn. He's not anemic. For his age, he looks pretty good, but he is pretty severely constipated. So they also did some Xrays, and that is a lot of poop right there. So I know I mentioned this morning that he was in the recovery hospital out at the rehab hospital, and he refused to eat this morning, and what he did poop was like rock solid. So Dr. Justin's going to be doing an enema, and we're going to see if we can clear him out and get him back in good shape. Again, he's 21 years old. He'll be 22 in April. And Jamie is also using the Furminator on him because in his old age, he's not grooming as well as he used to. So he's a little dirty, and instead of giving him a bath, we're just going to give him a really good brushing. So this has actually happened to Pharaoh one other time. Was this, does anybody recall? 2019, okay. October of 2019.
It's like right on his
So.
twice a day, 3 mLs.
So he's on a stool softener to try and help prevent this. Unfortunately, as they age, they can. I mean, he's equivalent to like 100-year-old females.
Yeah, definitely.
Sometimes they need some Miralax.
Right. He's not the only one. It definitely explains his grumpiness. I'd be grumpy too.
Yeah, that explains it.
It does. Because he's usually the sweetest boy. I know. When he starts hissing at the people he loves, you're like, okay, that's not cool.
Should he like not be getting him chicks? He gets a lot of those.
He says that he probably drink more, but he's wearing a bowls like every 20 feet.
Mm-hmm. Thank you, Karen, for the donation. Something.
Sometimes somebody posted a video the other day.
I love his little pink feet. Yeah, that was the first time I've ever seen somebody catch him actually enjoying a sickle. Do we know what flavor it was? Okay. Okay, yeah. So Dr. Justin's just getting set up here. That alone is going to make him feel better getting brushed like that. He was looking a little wintertime scraggly.
I try not to use the 8s because I know we're short on the 7s.
Thank you, Sharon, for the donation. Yeah, are you sure you don't want to put on like a full gown? So again, in 2019, this actually happened, and Justin was able to clear a lot out, which was really good for him. Thank you, Marcy, for the donation. 100% of your donations goes to the care of the cats, including their medical care. So he's also getting fluids. He's already had blood work and Xrays. Yeah.
Mine's more annoying than relaxing sounding.
I was like, why is that even going off? I have a feeling it's going to keep going off too.
Oh, that's for real. It's 4.
You're fine.
I'm sorry, can you repeat that?
So, did you want to send out?
We'll try and
I am
shoot
actually in the hospital right now, so if you just want to click and look everything up, and then you guys can. So, I'm done. Not this one, this one's that
Push
one.
it.
Yeah, you can. Thank you.
No, I don't. I got his tail blocking my view. His little wiggle worm.
Oh, cool. Am I okay to ship X-ray?
Do you want any post X-rays or?
I don't think so.
Okay.
Volunteering her. And like, would it be helpful to like try to push it out with from underneath too? Like squeeze it out. Oh.
Of course, they're cool. Because those are things like, too close to it where it's kind of smelly. Marinate?
Yeah,
Mm-hmm.
I was gonna say that. I mean, that could just aid in him having a. Give it a second.
Yes, if you guys missed it earlier, Dr. Justin said he does have pretty significant kidney disease. He has for a while, and he's 21 years old, which is like being 100 for a human. He's not always the best at drinking a lot of water, so constipation's not something that's super uncommon. We don't believe that he's eaten any kind of foreign object. We just don't think that he's been able to pass any feces for probably a week or so. 7 days, that's what I was thinking. Yeah.
It
And
was his third, the third day was Monday.
yeah. Yeah. That was our big sign. Yeah. So we're just kind of letting the solution set for a minute.
Do you see one?
Well, it's not in its right place.
Yeah, it's
It's
a
this
big
little
one.
one.
Yeah, that.
He's already been on lactulose, but we may introduce a new kind. Maybe like Miralax or something.
I don't know where it would have like disappeared to. Yeah, here. Like the last time.
Okay, sometime we'll loosen it up, 'cause it's very good.
See what else I was told on that whenever.
Yeah, this is almost done. The one school should be awesome.
I just love his little pink feet. Little toe beans. So Jamie's just taking this time to groom him really well. Get some of the dirt and extra fur off of him.
Firmest one I'm gonna ever go through. Trying to get out of it.
Well, with the piece I picked up today, I tried to squish it because I had gloves on,
Yeah.
and I couldn't.
You could.
It's just dirt.
I'm trying. I don't see anything like moving on it. Confusing when I like that. I think it would be easier when I like that. Well, I don't ever usually
I'd
see
say
dirt like
yes,
this.
but you'll die from allergies.
Yeah.
I mean, I'm already dying and I got a mask on.
Yeah.
Hi.
He's got perfectly snow white fur right here from, they shaved a little spot on his neck just to take some blood.
It's like bunny.
It is like bunny fur, it is. His little spot.
Get clean.
Bear with me, guys. I gotta turn off this alarm or it's gonna end up shutting down the live. So if it shuts down, I'll come back. Alright, hopefully you guys still see us.
I think the other reason he has problems when he gets constipated is he can't posture like normal. So he like literally is standing up straight trying to poop.
That makes sense, yeah. Yeah, he weighed 40 pounds, and like Max Bobcat and Shiloh Bobcat were just shy of 40. I can't remember what Gilligan was. That whole thing happened in a flash. I don't even remember.
Can you go bag of instruments and give me like a big pair of caramels? Yeah, I don't think there's any other bag.
What did you say?
Hallmark. Really good ones. They're the biggest that you got. That looks
Oh, poor baby. Poor bud.
not
He's gonna need a little donut to sit on. Poor guy. Yeah, we've already done X-rays, so we know exactly what the issue is. We're just...
Are those ones that we have next, I mean, they're big, but are those were the scissors, the big, long things that were next to our scissors? It's like, we just used sharp scissors, come off, I can't tell you what they were.
There were scissors, I think.
Yeah, yes, they're scissors, but that's just super long.
I can go look if you want.
No, I just didn't know. Ew,
feel it and
Did it work?
no, I
he just gooped them up.
was hoping I could
Very technical.
grab pieces of it and like break it apart, but I just didn't feel comfortable feeling it.
What, I'm flipping him over, or just that way?
Maybe try and put him on his back. And figure it out.
Your toes move. hanging up and down. Like gravity. Not like smell out like a bird. Oh, there's some.
Be a red, they say. It'll be fun. Gross.
Can you feel the hard part or is it
Yeah.
in the pelvis?
I can feel it just the tip of my finger.
But this hand can feel it at all?
Yeah.
Mm-hmm.
But it's really, I mean, it's only the size of this colon, but it's like just small enough, it's just big enough that you can't get out.
Mm-hmm.
Just big enough that it won't fit in the pelvis.
Poor baby.
Won't come out. What's happening?
Her lunch had something similar to what's coming out of there. It's been pregnant her being obviously it's better than me. That's right.
Yep. Poor choice.
She closed the home down here. A little bit. I forgot she was up there.
Oh.
Something hit the building.
I kind of forgot too.
She was up there. Oh, man. Oh, she left. I bet she left. People got the good end down there.
Yeah. I made sure they were all front and center. They want to watch these medical exams. This is what's happening.
So it's the size of a golf ball.
Oh, buddy.
It's pretty relevant for these
Oh,
messages.
Yeah.
Someone's getting all third. They want to.
Oh,
Okay, I will come off to the side now.
Is that a 3D camera?
Nope.
No, I did not do that for a reason. Nobody wants this in 3D.
Well, what's funnier is on here because he's so bright white and the lights just wash him out, you really only see like that area where it's dark now.
There must be interesting comments.
Actually, everybody's being very supportive. I thought there'd be some inappropriateness happening, but yeah, everybody loves Pharaoh.
Oh, does that mean there's something on the other side there? Would they put him out like that?
Maybe just one.
Buddy.
Honey, I'm so sorry.
We'll go look at his cute end real quick. Give everybody a break. Those big ears.
His big
I love his big ears.
This is the softest.
Yeah, the softest part, yeah. Oh, like velvet. Little velvet rabbit.
Is there any other kind of like food additive we could?
Miralax.
You just gotta start eating on all vegetables. All vegetable diet.
And all his water bowls.
I thought about doing that for lentils today because he wasn't eating.
I thought when you said his water was a weird color that that's what you did.
No,
No, I don't know if you tried to pee in it
no,
or.
it tastes like, I
Is it
don't know
like
if it's
that
that dish,
dish?
but it's after time that changes that color.
I blame, was it Poppy or Angel? Which one would not stop peeing in their water? I blame her. I think she permanently, yeah, the pea spirit.
Yeah, she would wait for you to make it nice and fresh. And then she'd be
Yes.
like, oh, thank you.
Definitely.
And they're back
Yeah, I pulled it up on our phone camera and tested it and it
That
changed.
camera's crazy.
So,
I'm like, Danny's in there. All I see is the wall.
I took a nap in there today.
I mean, it's just as well. We were creeping on you anyway, so we were like, that's probably what you're in there? Okay.
No, I got
Or
sleepy
fur?
and I was like, I'm gonna lay down. I don't want people seeing that.
Aw. Mom took a nap with you.
I was gonna say I want a nap with Pharaoh. That should be like a reward, like
Steph.
staff reward. You can go take one nap a month next to Pharaoh.
Can we name him
Yeah.
Now it's offended.
You sure get up here and go ahead and lay down.
You want him closer to your side?
Maybe.
Because you're like really leaning over.
Mm-hmm.
Oh, oh my.
You want a new towel or a new pee pad?
There's a stack right over here behind
There's one,
Aaron.
there's one here. There's one right behind you. There's a bunch.
Hang in there,
We're
Bubba.
finally getting somewhere. We're trying to work through the horrible hand cramps.
Ugh.
Oh, take him up by his inside. Oh.
Yeah.
But I think I feel very uncomfortable when it constipates. Right. Feel better.
Yeah.
It's not Saturday, I'm like, cutting through that. Sorry.
Wow. The beginning. That X-ray was unbelievable.
Mhm.
I don't know what to do, like,
Mm-hmm.
as far as the stage goes, because we need to monitor.
We changed his inside log. We could change his procedure to go back to when the log down on me. Make the log down there so we can find it, or put it in as a log down there, and that way it's, you know, this is a thing.
Like, they find, they, pretty, when it's not going through stuff like this, they find one every day, right? Or is there some days you just don't, but you want it to be on the sheet?
It should always go on the sheet.
Yeah.
Yeah.
So I think he's like a situation that if it was like more than a day, then he probably needs an extra dose or something. Cause at 3 days, then he's like this. And all the squishy stuff we've been giving him the last couple days here.
Yeah.
Mhm.
It has to be part
there.
So do you wanna do like, we should make it on Friday, 3 day, we give them an extra dose the next day, or 2 days?
This is like a weird first time it happens, cause we're gonna up it anyways. But then maybe we should go on just as regular observation sheet.
I just feel like it's easier, I'll get you one from you and one else. Like you don't have any time.
Is that everything coming around the sides of the hard piece?
I don't know.
Is that
I can't really feel anything else, so I don't think it's gonna be more firm this higher up. Do you know what I'm saying? Like I don't feel any
I was just wondering if you think you're getting any of the hard piece or is just the
no, I'm
stuff
getting
behind it?
no, this is the hard piece. This is all hard. I cut the majority of it. I think. More.
Do you wanna fill them up and let them sit again? Is there something like a Drano for animals that kind of fizzies it and like clears up the clog?
Good.
Like it's one of the snakes that Cause he likes the hose, he can just take them out and hose them up. I've actually never smelled anything like that doesn't smell like Pharaoh.
At least we know that we covered, because we can smell it. Still the line.
I think you can smell it at the end.
It's pretty intense. Poor buddy. Yeah, sorry guys, I don't know why, but it totally froze, so I shut the Wi-Fi off. And now we're on cell signal, so it should be coming back.
It's like it's an RV must.
But this might take a little while to work out anyway, so.
The news office and that's Fairwind, because we were sharing it, and it's like you open the door and it's immediately that person's office. So we always had it. I'm just glad this new house has 3 bathrooms. I can go get you. Now we're talking about. Thanks for coming out for our TED Talk.
Yeah. Well, lucky for you guys, it froze for a while, but when it came back, they probably caught the end of that and was very confused. Yeah, if it keeps cutting out, I'll probably just shut this down. But thank you to the 6 of you guys that have donated for Pharaoh. Hopefully we'll be able to clear some of that, and then I'm sure over the next few days, more and more will continue to come out. That's a good idea.
Who's carrying the back end? Oh man. Then I'll wrap it in a pea bag, just in case he empties a little bit on the way over.
Poor baby.
I didn't feel those things. Check the shirt.
He's fluffy enough to be able to just self-maintain being on his back. It's like perfectly like.
I'm not. I'm slightly holding and taking shallow breaths.
Mm-hmm.
Oh yeah, get ready for that. That reminder every hour. At the staff meeting, I was like, ding, ding, ding. We were all looking at it like, I should stand up. Definitely had them in a room. Yeah. I feel like every meeting has some sort of good text going on. There's always funny stuff happening. Always funny stuff happening.
Well, actually, it's mostly stuff just asking how much.
I don't know about that lunch. Crunchies is on point yesterday. Yeah, and you seem like it never fail. I did make them a commercial too. Crunchies is awesome. Ready for some yapping and snacking?
Is there activity?
Oh, it is like chocolate shake. All over the back end.
Oh, buddy. I'm gonna be really mad if you lured me over here and then something like flies this far over. I'm gonna be
I
like
just
really
wanted
mad.
a human shield.
Oh, that's awesome. It froze at the same time.
Good job, buddy.
Good stuff.
Oh, bud.
This is awesome. I was like, this is not gross.
That was fine, it just smelled terrible.
Mm-hmm.
I loved it. It was awesome.
It was strange.
It was super fascinating.
I would not consider this awesome.
What do you mean?
I like the one with my fingers and things. Like cutting off stuff and cutting open things.
He's like not like totally fine though. I even
He didn't care.
stopped giving him food.
Yeah.
He was like rubbing his face like all over everything that didn't bother him. He does seem, well, I don't know because I just stopped giving him Grumpiness this morning,
Yeah.
but he seems more like quiet.
He is less screamy. Yeah,
Yeah.
I don't hear the
He's on,
pterodactyl.
The thyroid meds twice a day now,
Gotcha.
which make him less screamy.
Yeah, he's usually very pterodactyl.
Flurry snack.
Scares me to death when I walk in the morning.
Oh, Lucifer.
Lucifer, yeah.
Why did you get a
He has the best meow.
He is so cute.
What's the worst though is when you're
But
around
like they
that
just
time,
removed
yeah.
that mask, you know, on his eye, and the very next morning he's trying to rub his face all over my shoes. I'm like,
course
no,
he is.
like stop.
I'm just like trying, like pushing it through this huge piece. Just trying to break it apart into smaller pieces.
You need like a grappling hook or
Do you need more like
People
more
with-
water and lube in that thing? You know what's causing this nerve cramps and stuff, really? Oh! It's frozen a lot.
He's gonna be so confused.
Oh no.
That was a bad idea. Don't take deep breaths.
No.
No, I'm very shallow. Leave it on site with masseuse for small breaks.
It's scary because you don't want to cause damage to the cold, but you gotta get it out.
Mhm.
Really nuts just open.
I think he just needs tummy rubs.
Mm-hmm. Belly rubs.
Oh.
Twice a day.
Sound effects brought to you by Afton.
It straight up looks like Nutella.
There's a lot of things I will not be eating anytime soon. Maybe just dinner in general. I think's off the table.
What was it that had the hummus? Was that huva?
That I think it was. Yeah, that was Uber.
Syrup on your ice cream.
No, thank you.
There you go. I can collect some for you. That's my hot water and milk.
I know. He's the sweetest boy.
You need to get yourself into it.
Can you tell if she was able to get that camera on?
Every single
My
piece of
assumption
yellow
is probably no, because it is still looking.
This way. Okay, yeah, I can't see where the angle is.
Like,
Yeah.
Oh, yeah, it's straight. Okay.
probably be fine.
It's all night, guys.
I agree. Let's go back to the cute end again for a little bit. His little cross balls.
Can you add more water to that?
Little squish face.
Or
I don't know if that gets caught up to burn. I will say the one in the office sure does. He flushed it and he brings hot water to my feet, and I'm like, oh, it's heat, nothing else in here, you touch it while it's getting warm, and it's like,
towards you.
something to be said about those color-coded sink tiles.
You work it? Okay.
bring it towards you more.
Still not the worst I've ever smelled in here. That would have been Shiraka, hands down.
Oh, that was gross. That's true.
And you Yeah. All the putties. Yeah, but I think I was on like a help mission at that point because I think I was just a volunteer. No, I think I was staff then.
No, I think you were filming.
I was the one that like went in the cage and pulled him in. I'd have to look on that. There's video footage of it. I think it was T.O. Mm-hmm. Yeah, I do. Because I was like Tommy or stuff like that.
That's true. Yeah, we were in that hospital.
Yep. And he was facing the doors.
I'm just gonna check on insurance.
Mm-hmm. That's what they all say now. Things are weird.
I mean, I'm not really doing much. Watching a metal explosion. I'll be back.
Oh, okay. I don't want to know what that's going to be like coming out of there. Like that. Whoa!
Oh, baby.
Oh, I know.
I'm the least grossed out, I think. I think it's slightly exciting.
I'm not gonna try and get any more truthfully. I'm afraid I'll hurt him. I just keep going. Because I think I broke it apart pretty good.
Yeah, you're on the.
There's this one piece right there. It's pretty smushy at this point. Ooh. Can't get it.
It's getting sticky right now. Oh, I know. Somebody breathe. Don't breathe.
He's a trap.
All his poor foot little nerves kicking crazy.
What are these?
We need to be a little bit
You
smaller.
can just move
We need to be like 30 pounds. Or I need bigger hands.
Should just remove this. I would left him on that, but I don't know if he needed to.
I was wondering when the crappy comments were gonna start happening. It's the first one I've seen.
What is that?
Crappy? Or-
Anyone gonna complain about how crappy their job is after watching this? But everyone agreed. No one's giving Pharaoh any new nicknames after this. he's a very good boy.
His butt? It's like jumping his nerves. It's like changing color.
I was gonna try and get in more.
Okay.
I think that definitely put him in a much better situation. But just like
Ooh, tomorrow.
other cats in the past, you know, we don't want to damage them, so it's a risk. Just doing this, but I don't think we really have a choice. What's your plan now?
We can just put them over here and rinse them off.
All right, so
He's gonna make a mess,
yeah,
no matter what.
yeah.
Oh, look, the table is close to theirs.
So they're gonna move Pharaoh over to our dental table because it's set up to be able to hose off. So we'll clean him up. This is about the extent of what we're gonna do today, and hopefully he was able to get him in a good place where he can start passing this on his own. I would imagine so. Uh-huh, yeah, it's being wafted into the air now.
Whoa, that is exciting.
I know
So-
you don't like it, but you could always give him fluids tomorrow if he's not pooping, right? No.
He was very nice.
Okay.
Like he kept charging me when I had to like get stuff out of there.
You think in this-
But he was posturing, you said?
You think he would tolerate it?
Maybe, I don't know. I mean, he was kind of angry.
You said he was posturing though?
Well, I mean, his posturing is like standing in
Yeah.
one place and like you can see his butt moving.
Alright.
He can't like arch his
You
back.
want this or
forward.
Yeah.
What do you guys think? Any now? Are you gonna move now?
Get it halfway in
Yeah,
there?
we can move him over there and
I'm gonna
I
move
can
this.
comb the other side of him.
Oh, we're this completely underneath there.
We could take him on the blanket over there. The yellow towel.
Mm-hmm. All the layers sounds good.
So we're ready when.
Wrap them up like a diaper. Yep.
Oh, sweet little burrito. All right, yeah. So we're just gonna get him cleaned up and then we'll be waking him up, and then he will be going, my guess is back into the rehab hospital for probably the next few days so that we can really monitor him closely. Because I think if we put him back outside, he would never look at us again. So,
Well, or just go and it's done.
yeah, and never come out again. All right, well, thank you very much to the 6 of you guys that donated, everybody who hung in there through this procedure today. So obviously with his age, this is something that's not super uncommon. It's happened twice with Pharaoh specifically. So we'll try to keep you guys updated. So just send all those well wishes to Pharaoh. And I doubt you'd want to rewatch this, but you can if you want to. It'll post automatically on our Facebook page. So thank you guys. Oh.